right, welcome back. We are coming to you from NAATP 2024 in beautiful Denver, Colorado. My name is Benjamin Turner. I am your behavioral health advocate. Sitting next to me is Staci Daniels-Sommers, the Chief Operating Officer at Vista Research Group. Staci, thanks for joining me.
Thanks for having me.
Can you tell me a little bit about yourself and then tell me a little bit about Vista?
Sure. I am a clinician by training. I'm a licensed clinical social worker, and I work with Vista. We work with outcomes, so it's perfect for me as a social worker who is interested in both uh, evaluation, but also the clinical side. I get to marry both into my role, and so Vista provides during treatment and post-treatment monitoring to look at how patients are doing. So we look at before they even come to treatment. We're looking at their history, treatment history, what symptoms they were struggling with prior to getting to treatment, um, any sort of social determinants of health, also some quality of life measures, such as were they involved in the criminal justice system? What was their uh, rate of going into the hospital for hospital stays? Then we track them during treatment related to co-occurring disorders. We work actually with both addiction treatment and also behavioral programs as well. And so they're asked on a weekly, biweekly basis or so how they're doing as far as their mental health symptoms. And then after they leave treatment, we actually follow up with them again
Great.
throughout the course of a year later to find out how they're doing post-treatment.
Awesome. Well, thank you for that. I want to talk a little bit about outcomes and data analytics. So, what types of data can be collected and analyzed to gain insight? So, what type of data are we talking about?
Sure. So we're looking really at patient reported data. That's something that's really important, especially for those clients who are Joint Commission accredited or other accrediting bodies. They really want to hear from the patients to get that patient centered care focus. And so we're looking at primarily sort of their symptoms. We're looking at how they're feeling related to depression, anxiety, trauma. All of those scales that we use are academically validated, which means that they are supposed to be used for that purpose to measure that across from teens all the way through adulthood. And so we're getting that on an ongoing basis to see change. That's what we're really looking for, to see how patients are changing over time and, of course, post treatment. So we're collecting data throughout their time of their treatment. We also make something really important to Vista is benchmarking. And so not only do we collect it on individual patients, but we also collect all that data and actually report out. We work a lot with NAATP as well. We are working with FoRSE, and
Awesome.
so our data for any clients who of ours they wish to have that data sent, we're just able to really provide both that clinician level care, but also looking at the big picture as well.
Yeah, absolutely. So, how can analytics identify gaps in care?
Yeah. What's there's a quote that sort of it's a longer quote, but the gist of it, people have heard it. Peter Drucker says, "What gets measured gets managed." He goes on to sort of talk about that in a more robust state, but that's the gist of it is that if you're looking at the data, you're able to see what actually is happening. So many times, either in our personal lives or, of course, in our professional lives, we have a sense of what's happening. Data allows that sense to come alive and to be sort of validated or to sometimes surprise us. And so being able to let that both at the patient level to see how the patient's doing, but then also look at it across your programs to see if there's any gaps. One thing we noticed during COVID, for example, is an increase in sort of the trauma experience. We saw those numbers go up. And so a treatment center can look at that and go, wow, we're actually seeing a more acute patient and be able to adjust how they're providing training to their staff, how they're hiring, how they're allocating time across the treatment program. So there's all kinds of things you can do when you can actually see sort of visually what's happening with your patients.
Awesome. Yeah, I love that quote. I think that's yeah, that really hits it. I mean, that expresses it. So, what metrics provide the most useful information about clinical effectiveness and patient progress?
That's a really good question. I'll answer. One thing that we know and research tells us is that the patient connection to the clinician is really important, and so this makes sort of sense, right? If you are sort of feeling heard,
Mhm.
supported, and valued by the person trying to support you, you're going to be able to access the information they're providing you better. And so we look at client satisfaction, their connection with their clinicians, and things of that nature. We look at again both on that individual patient. We collect all their comments. Clinicians can see what their comments are on a weekly basis, but also across the board. So in our reporting, we look at comments that people are providing throughout the time in treatment. You can kind of see themes of what works well, residential centers always there's always mention of food. That happens a lot. But in any case, you can sort of see what things in our program people are really connecting to. So having that sort of background of understanding that the patient really feel connected to where they're going. The second piece is just around some of those vectors I talked about. And so that sort of pre-treatment, during treatment, and post-treatment vibe of sort of being able to see sort of
Mhm.
a longitudinal pattern for patients and being able to connect all of those things together is really important as
Yeah.
well.
Awesome. I want to talk a little bit about technology and what you guys do. So you're technology, and facilities use technology in a number of ways. Can you talk about how you work with existing technologies and what it looks like to utilize you in the facility?
Sure. So we are a web-based application. So that means if you have any device that has web access, whether it's Silk for Amazon, of course, Chrome, Safari, you can get to our software. And so they usually have to have some sort of device, especially for our residential centers, to have a device that patients can have access to, which usually is pretty easy to do since we're web-based. You can use anything that you know that you have on hand to do that. For our outpatient centers, though, we send the surveys directly to the patient. So we either email or text them.
Yeah.
So they can fill it out on their own time. I have a private practice and my patients use it as well. So sometimes in treatment, I'll see, they didn't do their survey. Can you take out your phone real quick? I can push a button, sends right to them, and they can complete that
Yeah.
survey really quickly.
Okay. How does the staff encourage this, or I get the use of the technology, the tablet or the phone. How do clinicians encourage this to occur?
So I think some of our most successful clients really see it as a part of treatment.
Hmm.
Uh, I'm a clinician. That human connection is really important, but having a little bit of data sometimes can illuminate things that we weren't expecting, we're not catching, we didn't know, we didn't see it that way.
Hmm.
And so we really encourage. I think the best kind is I do this myself is to encourage folks to uh, integrate it into the clinical process. Like this information helps me to better see the big picture,
Hmm.
so I can help you to see the big
Yeah,
picture, and we can work together.
absolutely. The data that you collect inside one facility, how does it work with the data collected in another facility, and how does that benefit everybody?
Sure. So obviously, facility to facility, they can only see their own
Hmm.
data. However, we do report out in aggregate
Hmm.
anonymously, so patient you can't tell if it's large data sets. We report out both to the treatment center. They get a report every annually to see how their data is doing. But also, we have reporting that we look at and we share out with the public. We not just treatment centers to know about us, and of course, working with our colleagues, but also families. They can also access this information to better understand what works in addiction treatment. That was one of the things referenced earlier in the opening session is understanding that treatment works.
Yes.
And our data is able to show that,
Mhm.
staying in treatment longer works. Having support helps
Yeah.
work. So our data, we share that out in reporting on social media to help educate people about addiction treatment and about behavioral health as well.
Absolutely. Yeah, I think outcomes is such a popular word now in behavioral health, and I
Yes.
think it's because this data was so siloed and really not even being collected and being analyzed. And you hinted at that. So, it's really great to be able to have opportunities like yours to enforce to start to gather the data that has not been able to be collected, start to analyze it, and so that we can start understanding where treatment is successful and not successful. Is that correct? Is that the goal here?
Absolutely. So first of all, knowing that there's other outcomes uh, companies coming up and starting up and being around, it's super exciting. That's
Yes.
exciting to see that there's a groundswell of us watching FoRSE come to life. I've talked to Dr. Peters a number of times, and so is our founder as well, and being able to share that data with them so that they can build their repository. It's just really exciting. We've been at this for almost 8 years now, and so seeing how things are evolving, how treatment centers are more engaged and using it, it's just super exciting.
It is exciting. I for one am excited about the press for more data, more outcomes. Let's analyze it. Let's gather it. Staci, I really appreciate your time.
Thank you.
Before I let you go, is there anything that I didn't cover that you really want people to know about, and anything that I didn't hit?
You did a fantastic job. Thanks for giving me the opportunity to talk
Absolutely.
about it.
Staci, thank you so much. Again, we've got Staci Daniels-Sommers, the Chief Operating Officer at Vista Research Group. Thanks so much for joining us
Of course,
today.
thanks for having me. Take care.
That's it.